Welcome and thank you for viewing the presentation. During this session, I will review the approach to fetal cardiovascular imaging of second and third trimester twins and multiples with a method that I find successful. This presentation will exclusively cover the fetal echo approach to multiples, and it's not intended as a complete fetal echocardiogram or anatomy exam. Please review my channel for other videos related to fetal echo, scanning, and basic fetal echo protocol. Typically for second and third trimester fetal cardiac exams, the type of twins or multiples is predetermined by the referring obstetrician or maternal fetal specialist and is therefore not determined during the fetal cardiac exam. So determination of chronicity will not be part of this presentation. So there are two main types of twinning or multiples. You have fraternal twins, which is dizygotic, where two eggs are released from the ovaries, and then each egg is fertilized by separate sperm. And then after that, each embryo implants into the womb separately. And this is considered dichorionic, diamniotic twins, where there are separate placentas and separate inner sacs. With identical or monozygotic twins, one egg is released from an ovary and is fertilized by one sperm. And there are three different types. The first type is where the early embryo splits before implanting into the womb. And once it implants into the womb, the two embryos are separate with separate placentas and separate inner sacs. And this is also considered dichoriotic, diamniotic. The next type, the early embryo implants into the womb and then splits after implantation, and this is considered monochorionic diamniotic, where both fetuses share a placenta, but they have separate inner sacs. And the third type is where the early embryo implants in the womb and then splits much later, and this results in the fetuses sharing the placenta and also sharing the inner sac, but they are not separated, and this is considered monochorionic, monoamniotic. So in starting one of these scans, the first thing that should be done is an orientation sweep to evaluate the position of each fetus. As you can see, there are many different position types and several methods to establish this. Scanning multiples can be very intimidating, and so there are many different challenges that we face while scanning multiples, the first of which is difficulty isolating each of the fetuses. Now this is called a fundal sweep, and I find that this is the most effective way to orient myself to the fetuses in a multiple scan, and this is done by placing the transducer in the lower maternal abdomen in a transverse format and then sweeping cephalad on the maternal abdomen, and this gives me an overview of where the fetuses are positioned within the amniotic sacs. And this is an example of that. This is a transverse abdominal sweep, fundal sweep from near the cervix, where you see very little of the amnion, and we sweep cephalad on the maternal abdomen. You can see this is a monochorionic, monoamniotic twin pregnancy, and both twins are cephalic. First thing you see are the fetal heads. The placenta has anterior and right lateral components, and you can clearly see that there is not a membrane separating these fetuses. Another factor is a limited range of imaging for each of the fetuses due to surrounding structures. And so I'm going to use this maternal fetal MRI, transverse MRI through the maternal abdomen, as an example of the limitations that we've run into. This is a singleton, and you can see on either side of this gravid uterus we have structures, bowel, the spleen, kidneys in that region, and so we want to avoid that. And so for singleton, we have this large sort of sector that we can scan from, And so as we scan across the maternal abdomen, we have really more than 90 degrees to work with. Now you can see the difference between the singleton and the twin pregnancy here, same view, and what we have is the same limiting factors, except for on the other side of the A fetus, which is on the maternal left, you can see the other fetus, and this greatly limits the amount of imaging for each of the fetuses. Now, the other fetus is also limited by the first fetus, but also by this large fibroid in the right aspect of the maternal uterus. And so while you can image through fibroids, large fibroids, they do create some attenuation of the ultrasound, and quality of imaging is not as crisp. Now, as you can see from this image, you can understand just how limiting it can be to image one of the fetuses when the other one is sort of blocking the fetus. And so this is twin A. This is a transverse view through the maternal abdomen. Twin A, the first twin, is cephalic, the spine is up, and you can see clearly that from where we are imaging, we would not be able to see twin B very clearly. However, in that sagittal view, the orthogonal view to the previous, you can see just how clear A is coming in, and then to get to B, we would have to do some maneuvering to get the images to be appropriately and clearly seen. And so from that angle that we had, we would take the transducer and translate it over, down lower and more leftward. That way we would be getting a more direct and clear image of fetus B. And you can see that we've annotated that fetus B is transverse with head right, and we're having a nice clear four-chamber view through the mid-thorax without twin A being in the way. And lastly, these exams may take much longer than scanning a singleton fetus, and so the operator should take breaks if they feel the need to. The clock method is a very effective way to evaluate cardiac situs. The way this is done is we treat the transverse fetal thoracic four-chamber view as a clock face, where the spine is always going to be 12 o'clock. If the fetus is in a breech presentation as shown here, then this view with your orientation marker in the correct place, transverse through the fetal chest, the apex in the plane of the ventricular septum, the cardiac axis, the apex should be pointing at 7 o'clock. Again, the spine is 12 o'clock. If the fetus is in a cephalic presentation, that same clock is used with the spine at 12 o'clock. The apex should be pointing approximately 5 o'clock. This is the clock method. This is a very effective method to tell what is the left side of the fetal chest in either breech or cephalic presentation. And so in performing this assessment, you'll note that this fetus is twin A is in a cephalic presentation on the maternal right side, and if you're using the spine as 12 o'clock, the spine is over here and the apex is clearly pointing to 5 o'clock, and so this is levocardia in this twin. So in terms of tips, one of the most important things to remember is that you're performing a full scan on each one of these fetuses, and so it's critical to maintain focus on each individual fetus until the end of your scan at that time with that fetus, and then you move on to the next fetus. Now again, we'll start at the lower end of the abdomen in the pelvic region, transverse marker at the maternal right side, and perform our fundal sweep, and that means sweeping up the abdomen to the top of the abdomen to the fundus of the uterus. And this is what the sweep should look like. First, you're starting in that transverse marker at maternal right side, and you're seeing through this sweep the fetus that's on the left side, maternal left side, is going to be A because the head shows up first. It's a cephalic presenting fetus. On the left, that is the first fetus that comes into view. And then on the maternal right, you can see that the second fetus, fetus B, shows up here as breech. And as you continue that sweep toward the fundus of the uterus, you see the head show up last. And now at this point, we'll start our attention to focus on twin A. And so this is twin A in a sagittal format. Again, the fetus is a cephalic presenting fetus. And so this is our first image. And now from that sagittal view, we're going to turn counterclockwise 90 degrees for a transverse view through this fetus, the fetal twin A. And we're seeing a normal left-sided stomach, right-sided liver, levocardia. And this evaluation through twin A will be complete in terms of all of the views and all of the physiologic assessment throughout twin A, and then we will move to twin B. And so all of these normal sweeps and views through the valves, through the chambers, looking all the way up into the upper chest, showing the 3-vessel tracheal view, nice normal view of that. There, with the trachea here in the center and the left arch, left ductal arch, normal SVC. And then following that up with color Doppler of the pulmonary veins and all of the necessary images. Here is the ventricular septum. Nice zoomed up look at the valves for measurement here. And a nice color Doppler, color compare image of the 3-vessel tracheal view, normal physiology through here, normal velocities and normal direction of flow. And then we'll turn to the sagittal images and we'll finish our study with all of these views of the long axis arches, the bicaval view, looking nicely at the diaphragm here. And again, this is not a complete study, it's just an example, an abbreviated example of how we would evaluate each of the twins and then move on to the next twin. And so here is twin B in a sagittal scan through maternal abdomen. Twin B is breech and right, and so this would be the first image for twin B. And then we would perform the rest of the study just as we had done on twin A. Now, one of the most challenging things we face as sonographers in scanning multiples is losing track of which fetus you are on, and so you need to occasionally reevaluate your scanning region. And so the method that I find pretty successful is to, as you're scanning one of the fetuses, in this case we are scanning twin A, breech right, and we have a nice 4-chamber view here, transection through the thorax with a rib on either side, perfect view, but I'm not sure if this is twin A or twin B, and so what I would do is zoom out and pan over to twin B just to make sure that this is indeed twin A. And so this is a different orientation. This fetus on the left side is cephalic, and the other fetus was a breech presentation. A similar method is just to pan all the way out and do a broad overview of both of these fetuses. And so in this case, what I've done is I've zoomed out or panned out, and I'm making sure that I'm clearly seeing both of these twins, and then I will turn sagittal on the twin that I want to focus on, and in this case it's twin B, and this fetus is in a breech right position. And that would allow me to then focus more on twin B in those transverse thoracic 4-chamber upper chest views. And so then I would, after this, zoom in on this fetus and create a really good tight image. And of course, twin A is very active, as they usually are, and so you would need to avoid losing track of that by occasionally panning out and reestablishing where you are. Another important tip that I teach is to place the transducer in a way that you are scanning the fetal head first on the twin that you want to focus on, and then rotate the transducer in a way that aligns the spine with the head. And so here we're starting with our fundal sweep, and as we sweep through in this transverse format, we can see twins, and the first twin, you see the head first, is on the maternal right, and at the very end of that sweep you can see twin B is sort of a cephalic but oblique, almost transverse at the end of that sweep. And so twin A, right, cephalic, longitudinal, and so from that we would see a picture like this where we start with the head of A and then we would rotate to get the spine aligned, and we would do the same thing for B. And so here's twin A, we've turned sagittal and we've aligned the head with the spine, and now the spine is perpendicular to the imaging plane, which is what you want, and then the diaphragm, or the plane of the diaphragm, and the heart would be in the center of the sector, so that when you turn orthogonal to this 90 degrees, counterclockwise, you would get a nice four-chamber view. And so here we've rotated the transducer 90 degrees and we're seeing a nice four-chamber view through the mid-thorax. Perfect example of that. And once more, you perform one fetus at a time, and you start with the first fetus, which is A, the closest fetus to the cervix, and then you complete the full study on that fetus before moving to your next fetus. Now, fetal imaging planes are obtained by the two main body planes, and so you see the transverse plane here, which these transverse views come from that plane, and then the sagittal body plane, which the sagittal views come from. And it's important to note that the cardiac imaging planes are slightly off from these fetal body planes, and so slight rotations may need to be made specifically when imaging these views, and things look a little bit off. Specifically, the rib shadows are not one rib on either side. There are multiple ribs shown. Slight rotations may need to be made to get that to look proper. But you can see that from the four-chamber view up to the outflow tracts, and then the three-vessel and three-vessel tracheal view, they're just slight sweeps more cephalad in the fetus in that transverse view through the fetal chest. Now this is an illustration of the fetus in the sagittal plane here, and you can see the diaphragm bisecting the upper and lower halves of the fetus. For imaging, we want to have the spine as perpendicular to the imaging plane as possible. And so here's our example. Here is the plane of the diaphragm. You can clearly see the difference in echogenicity of the lung tissue here in the upper thorax versus crossing the diaphragm in the abdomen, the liver, and the stomach here. But what is important is to place the diaphragm and really the cardiac mass in the center of the sector when imaging, so that when you turn to a transverse view orthogonal to that sagittal view, you can get as near a perfect four-chamber view to start out with as possible. And so this is an example of that. We've placed that part of the heart where the diaphragm, where the heart sat on top of the diaphragm in the center of the sector, and when we turn to a transverse view, we get this perfect four-chamber view, a single rib on either side, and as we sweep cephalad, we can get all of the views we need just based on that one spot where we're imaging through the fetal chest. And of course, from that upper chest view, you can rotate slightly to get these other views. This is the three-vessel view here with the SVC aorta and main pulmonary artery bifurcation of the pulmonary arteries here. This is slightly off. You see this rib has turned into sort of a half a rib, and there's another rib over here. Same thing on this side. You're seeing part of a rib here. Since we've rotated ever so slightly. And this trick is just to watch the image as you're doing these slight rotations. Now, indeed, the most challenging aspect of scanning multiples is when we're scanning more than 2 fetuses at a time. And so in this case, this is triplets. And the challenge comes from having less room to scan and isolate each of these fetuses. And so again, we'll start with this first fetus, which is fetus A, and perform the full scan within this little sector of space. And then fetus B, which is the next closest to the cervix, will be the next fetus, and we will try to isolate this fetus the best we can with this small amount of room. And then this is fetus C, and we'll finish up with fetus C. And so we start with our fundal sweep as before with the twins, and we find 3 fetuses within this uterus. And so the first fetus, you see the head first, there's the body, next fetus is here, and then finally the third fetus is more superior up here, head to the maternal right side. And so if we slow this down, we can see this quite clearly. And that's the beauty with Cine Eclipse, is that you can scroll all the way to the beginning. And as we come to fetus A, you see the head of fetus A. We see the body going off to the maternal right. We start to immediately see another fetus show up, and that's the rump of the fetus. So that's the bottom of the fetus. That would be more of a breech oblique. Since we're scanning in a transverse format doing our fundal sweep, we see the bottom backside of the fetus here, the pelvic region, here's the bladder, the spine goes this way, and so this is mostly transverse for that fetus. And then we sweep more cephalad, we start to see fetus C. Again, the thorax is pointed mostly to the maternal right. You start to see the spine and more of a transverse format, and so this fetus is transverse. You see here, this is the pelvic region of fetus C, and more superior and more cephalad in the maternal abdomen. The head is going to show up over here. And so at the end of that sweep, we've already figured out how each fetus is situated within the maternal uterus. Again, we would start with fetus A, as we see here, the cephalic presentation. Remember, the first fetus was closest to the cervix. The head here was presenting first with a cephalic presentation, longitudinal, and this is the 90 degrees counterclockwise rotation, showing the stomach on the left. Again, 12 o'clock, the apex is pointed to 5 o'clock like it should in a cephalic presentation. And that would be fetus A, and we would continue the scan with fetus A, and then we would move on to fetus B as shown here. Again, remember, fetus B was more of a breech presentation, and so we're seeing that. We're seeing the spine here, the head. Again, the marker is at the maternal head, and so this is a breech presentation, 90 degrees orthogonal to that view, and you are going to get this picture in the transverse thorax here, 4-chamber. You see the spine here, that's the 12 o'clock mark. Again, this fetus is breech, and so we should see that apex at around 7 o'clock, and we do, so this is levocardia. And we would continue the scan with fetus B until we were finished with all of the assessment, and we would move to fetus C. And if we remember, fetus C was in a transverse presentation with the head to the maternal right, again in the fundus of the uterus, and so more superior. And we can see this apex pointing toward the left. Again, this is 12 o'clock, and in this transverse but head right fetus, we treat that as a cephalic lie. And so when we turn orthogonal, we can see that the fetal head is to the right. And you can see the heart here. You can see the plane of the diaphragm. And so with that in the center of the sector, we will again turn back to our 4-chamber view. And this is the assessment we would do. Nice 4-chamber view, mid-thorax, levocardia, apex pointed to 5 o'clock. We would finish our scan on fetus C, and we would be completed with the triplet assessment. Now, one should keep in mind these considerations when you're scanning multichorionic pregnancies. Keep in mind that multichorionic pregnancies are considered fraternal multiples, so they may have differing genders. There may be the presence of structural abnormalities in one or more of the fetuses, which may be different, and so that may also help you differentiate the fetuses if you are confused about which fetus you are currently scanning. And also the fetal position, presentation, and lie of each fetus helps to clue you in as to which one you are currently scanning. This is an example of using gender as a differentiating factor in terms of scanning these dichorionic diamniotic twins. You see that twin A, when you're looking in the pelvic region, you can clearly see that this is a male, and then twin B is a female. And so as you're scanning each of these fetuses, you could pan down to the pelvic region and just confirm that you are scanning the fetus you intend to scan. This is an example of dichorionic diamniotic twins, again fraternal twins, where twin B has a normal 4-chamber appearance here, shown with the cardiac mass situated in the correct place within the chest, and no other abnormalities that we can see in this view. And with twin A, we see that there is a large left CPAM, and so that's shifting the heart more rightward, and we can clearly see that this is an abnormality in twin A, which is not in twin B. And so when we're scanning either of these twins, we can differentiate them based on this abnormality present in one of the twins. So in summary, these are the key take-home points that you should remember. Use the fundal sweep for initial orientation of the fetuses, the number and lie of each fetus. Maintain your focus on each individual fetus and stay with that fetus until the exam for that fetus is completed, and then move to the next. You want to re-evaluate your scanning region occasionally, which just means panning out or zooming out and ensuring that you are scanning the fetus that you have intended to scan. And also remember that you can use differing features in non-monochorionics or multichorionic pregnancies. You can use differing fetal location and lie to identify. You can see the differences between the genders and ensure that you are scanning the correct fetus in that method. And also the presence of structural abnormalities in either of the fetuses can help you differentiate between fetuses. And once again, I want to thank you so much for viewing the presentation. Please check my channel for other presentations related to fetal echocardiography.